It's not always the most comfortable part of your doctor's visit,
Relax your squeeze for me, buddy.
but health experts say your blood can reveal a lot about your overall health.
Lab work is kind of part of a puzzle piece, and we use that in order to determine what's going on.
Nurse practitioner Marissa Roberts says blood work typically checks for 3 things: CBC, metabolic panel, and a fasting lipid panel.
A CBC is a complete blood count, so that's where we look at your complete blood count. We look at red blood cells, white blood cells.
Patients with a low hemoglobin or anemia may experience dizziness, shortness of breath, or fatigue, which could be caused by diet, age, or a medical condition that needs to be evaluated.
If somebody comes in and they're complaining of fatigue and it's been 6 months since they've had their last lab work done, then we'll go ahead and draw those labs.
They also look at the metabolic panels, which check for electrolytes, potassium, sodium, and calcium.
We also check liver function and kidney function to make sure that your organs are working the way that they're supposed to.
Other times, doctors may request patients to do a fasting lab where the patient can't eat for 12 hours.
One of the biggest reasons that we do fasting labs is to get that baseline. We want to see how your body deals with glucose without any additional food.
Depending on the results, patients may need to have more blood work to make sure they aren't at risk for diabetes or other health conditions.
It is so important to come in for annual labs, and it is so important for us to monitor these things.
Patients are encouraged to get their blood work checked every year. If the patient is experiencing symptoms, health experts may decide to do blood work more often, all to keep an eye out on the patient's overall health. For Lee Health, I'm Lindsay Morton.